It is saying that it will require permission.
Permission?
Yes.
No permission. Host control is not there. I will see.
Okay.
No, participants can share their screen, no problem.
Okay, yes. I'm now able to share.
Yeah, thank you. Good evening. Okay.
Screen is visible. Okay.
Screen will be visible. We will try after that.
Yes.
Good evening, everyone. This is Veer Maheshwar Charitable Trust Latur MS India, organizing daily international webinar series. In this series, the speakers are invited from India and abroad from various fields. They are delivering their topics as per their research and field of interest. And every day we are enriching in the knowledge on various topics from the resource persons. Today we welcome Dr. Nayan Gupta ma'am, who is Ph.D. FAAO, FIACLE, Academician, researcher, ophthalmologist, clinician from Greater Noida. We welcome you, ma'am, from my organization and all the participants, those who are joined here. She is assistant professor at Chitkara University, presently working as assistant professor at Galgotias University. She is Ph.D. in optometry and a fellow of the American Academy of Ophthalmology, FAAO. And she have published reputed journals, research papers in the reputed journals. And she is interested in clinical research, and her commitment is advancing knowledge in the field like binocular vision, neuro-ophthalmologist evaluation, and pediatric optometry. We welcome you, ma'am, and we request you can start your speech. Thank you.
Thank you so much, sir, for the invitation. And I am very glad to discuss today about the recent innovations in eye care. So, as sir has introduced, myself, Dr. Nayan Gupta, and today I will be discussing about recent innovations in eye care. Definitely, as an academician, as a researcher in optometry, I've always been, fascinated by how rapidly technology is transforming the field of eye care. If we talk about that over the last decade, definitely advances in the artificial intelligence, imaging technologies, and nowadays even we have soft contact lenses, we have telemedicine, even the gene therapy. These areas have significantly changed how we diagnose, how we treat the various eye conditions, the various eye diseases. And in today's presentation, I will discuss how these innovations are improving the early diagnosis, the treatment, outcomes, and accessibility of eye care and patient monitoring. Because it is one of the most crucial factors which ultimately helps in reducing the preventable blindness worldwide, globally, I would say that. When we talk about importance of vision, definitely vision is something, one of our sense organs, right? And this is somewhere linked to the quality of life of an individual. As you, me, working in today's scenario, if we do not have an adequate vision, definitely, your quality of life is compromised at one or the other point. I would rather say that, people who are visually impaired, definitely they are performing better, they are at better positions, they are doing things like a normal individual, but there is somewhere something which definitely impacts their quality of life. It takes a lot of a big heart to be a person with visually impaired and doing those activities just like a normal individual. So vision is definitely the most dominant sensory system in humans, and studies that have indicated around 80% of the information that our brain is receiving from the environment, and that is visually that we see. 80% of the information that we are seeing is visually seen, right? And definitely, if we talk about navigating our surroundings, we talk about recognizing of faces, objects, reading, learning, and even performing any complex tasks like driving or so on. These all visual functions definitely get compromised. Individuals definitely may experience significant challenges in education, employment, and even daily independence. Therefore, preserving the vision is not just our medical goal, but I would rather say it is also very critical factor in improving the overall quality of life of an individual. 2.2 billion people, when we see this number as people who are visually impaired, this not only individuals, this number is not only just a small number but also a large part of our society. When we talk about the societal perspectives towards visual impairment, reduced workforce, probably increased healthcare expenditures, greater needs for social support systems, all of these factors contribute towards these visual impairment. And individuals, if you see that with visual impairments may struggle with probably employment opportunities, or they may require assistance with daily activities, but this places the financial and the social burden on communities as well as the healthcare systems. Therefore, I would rather say this, that innovations in eye care are essential not only for improving the individual patient outcomes, but I would rather say that it is also important for reducing the global burden of the visual disability that we have. We talk about this global burden, and when we talk about innovations in eye care, 47% of the recent innovations have come up since 2020. And, with newer techniques, definitely we are able to diagnose better, we are able to manage better. The global visual impairment remains as a public health concern, definitely, and this approximately 2.2 billion population worldwide, they suffer from some or the other visual impairment. What causes this visual impairment? Why are these people visually impaired, if I would rather say? And the important point here is that the early detection is not done. I would say that increased accessibility, we have to provide accessibility, because the things were not accessible to the rural populations of India, wherein people, they could not get even a simple cataract surgery treated rightly, and that led to visual impairment. Technological innovations, definitely, that allows us large scale screening programs. So a country like India, where a large scale screening programs in the rural parts is very very essential. Metropolitan cities, yes, we can say things are available, it is easy accessible, you can just walk out of your home, and definitely 10th door might be an eye care practitioner, or you can visit an eye doctor. But if you are really talking about the rural areas, or if you're talking about the villages, definitely the eye care is somewhere, is a larger scale screening programs become very very essential, because definitely there is a lacune, there is scarcity of the, even the healthcare, the eye care providers, the optometrists, the vision technicians, there is lack of these people serving in those areas. The evolution of eye care, I would say that this has been emerging, and there are several challenges to that as well. Eye care has undergone a remarkable transformation over the past century. Various inventions in ophthalmoscopes, the instrument which is helpful in diagnosing the various diseases of the retina. We call it as ophthalmoscope, and this has evolved a lot from a basic ophthalmoscope, from a lens. It has evolved to a big hefty machine, and which can even actually tell you about the micro layers of your retina. Definitely, traditional methods heavily rely on the subjective assessment. How one person is doing, and it may vary from the diagnosis of the other ophthalmologist, probably maybe in the same institute as well sometimes. But this critical thinking when it comes to diagnosis and when it comes to managing a patient, when multiple doctors of the same domain link together and work, I believe that that is somewhere which that is something which can actually help the patient, which can actually promote the research and innovation, which truly is the need of the hour today. And this evolution definitely will help in diagnostic accuracy, treatment outcomes for the patient, and patient's accessibility also. Because one idea, if yeah, there are 2 to 3 people who are treating a patient, those 3 people will have 3 different perspectives. Science is something which will remain same, the between among all those 3 people, but definitely the ideas, the way that you counsel the patient, it becomes a very important, and that is somewhere where the evolution of eye care actually started. Definitely, I would rather say that there are challenges in eye care. There is limited accessibility to advanced eye care. As I spoke, about the developing regions of our country, developing regions all over the globe. I would also say that higher cost barriers. Definitely, the AI, the innovation, the machine that has come into market. Definitely, it is not going to be a very small, challenging thing, right? It is not as simple as a normal, a consultation fee for the patient. Definitely, it is going to be a hefty amount that the patient will be paying for those tests and for those investigations. But yes, those things are available. Despite the financial burden, if we remove, definitely these treatments, the cutting edge treatments are available. Even the gene therapies, the bionic implants of the eye, definitely these have limited access in today's worldwide, but definitely coming years, a decade's time, I would say it would rather take that, to bring all these practices, very much accessible, pocket friendly to all of us. The regulatory hurdles that slow the approval of innovative technologies, delaying life challenging treatments for patients, because anything that has come into market definitely will require research, will there will be a need to actually there will be a need to actually conduct that, take that instrument into the market, get a survey done, and get it accessible. A research is needed, to see its authenticity, to see its accuracy, to see its reliability as well. So that also becomes life changing challenge, I would say, for all the healthcare practitioners, because a specific team has to be dedicated who will be, working on that particular research and getting that innovation into practice. Because innovation, I would say, doing an innovation is not important, but getting it into practice, getting it into actual world, getting it into the market is important. आज मैंने कुछ इन्वेंट कर दिया, but it is limited to my lab, it is limited to my institute, it does not make a difference. But if I'm going to take that instrument and get a patent done out of it, taking it to the market, and when it is actually checked for accuracy, reliability, and all those factors, and it is into the market, people are using, the healthcare professionals are using, and I would rather say that is a successful point. Inventing something, developing something, keeping it in your premises, not, making it available to for your patients and the other healthcare professionals. That is a lacuna that still we have in our country. There are major causes of visual loss, definitely uncorrected refractive errors. Millions of people who need visual correction, but they are surviving still good, saying that I can see better. Because they don't want to spend, they might not want to go for an eye checkup. They might have some myths about wearing spectacles. They still might believe that sunlight would help in reducing their power. Probably they believe that eating almonds or a healthy diet is sufficient enough to correct a refractive error. There would be significant myths about this as well. Cataract, a very simple 10 minutes surgical procedure. Today, it takes 10 minutes. But this is also one of the leading causes of visual impairment worldwide. And yes, glaucoma, which is a progressive disease, and this can even lead to, irreversible blindness, I would say. So definitely, there are several emerging challenges that I had quoted. Though there are, eye care has evolved significantly over the past century. The early days, eye examinations definitely relied on manual observations, techniques, basic optical instruments. All of this together, when integrated with the help of today's artificial intelligence, telemedicine, digital health platforms, is ushering in the new era of the eye care. The necessity of innovation. There are several emerging challenges, I would say, that make the innovations in the eye care increasingly important. Firstly, if I talk about global population aging rapidly, which increases the prevalence of age related eye diseases such as cataracts, glaucomas, macular degenerations. Secondly, if I talk about global prevalence of diabetes, I talk about myopia, which is one of the increasing burden, global burden, I would say. And this is rapidly increasing. And various research studies have shown that it is going to boom. By 2050, half of the world's population will be myopic. That is what they have predicted. And the higher risks of definitely with diabetes and with myopia, there are higher risks of retinal degenerations. We call it diabetic retinopathy. We call it myopic degenerations. Finally, I would say that here modern lifestyles definitely involve prolonged screen exposures, increasing the incidence of digital eye strain. Nowadays, you, me, everyone, we cannot survive without a laptop, we cannot survive without a mobile screen, right? So, directly or indirectly, this incidence of digital eye strain is definitely somewhere, causing the necessity for innovation in eye care, because it is linked to dry eyes, it is related to eye strain, and eye strain is just not a fatigue or just a simple strain. It is definitely something which is related to the muscles of the eye. And to address these challenges, we need advanced diagnostic tools, we need improved treatment technologies, and more accessible eye care delivery systems. Evolution of eye care has evolved significantly over the past century. And if you talk about early days, definitely eye examinations relied mainly on manual observation techniques and basic optical instruments that were available. But with the technological progress, imaging technologies such as nowadays we have fundus photography, your retina, what your retinal layers, optical coherence tomography. These techniques, fundus photography, OCT, we call it optical coherence tomography, these all are available, and the clinicians can visualize the internal ocular structures with remarkable details. I would say if that micron, zero point 0.1 micron also is visible in those reports. And definitely with all these increasing technology, the availability is one factor that we need to really work upon. But yes, availability is there, and there is nothing which cannot be treated, right? So later, definitely, I would say laser technologies have come up. They have revolutionized the surgical procedures by enabling more precision and minimal invasive treatments. So today, the integration of this artificial intelligence, telemedicine, digital eye health platforms, this is all, ushering in this today's era of eye care, and it is significant. Even various, retinal scans, they use CNNs. Okay, these CNNs, these can actually analyze our retinal scans, and they are, give us remarkable precision. They help in detection of the invisible patterns of the human eye. OCT fundus photographs, these commonly use it. And these deep learning models are, you know, um, very helpful in diagnostic accuracy. And that accuracy even exceeds more than 95%. And this has been proven in our researches as well. If you talk about seeing beyond the surface, I would say that is where OCT is one of the important imaging tool that we have in today's our eye care system. And this is one of the, it's, I would not say that it is a recent innovation. Yes, it is it is there from last 22 decades, 2 decades I would say. But but there is innovation happening in this same tomography every day. I would say researchers all over the globe are working on this area, and making it more better. We have OCT specific for our corneal health. We have OCT specific for our retinal health. We have an OCT which is specifically for the glaucoma patients. Right. So this innovations definitely provide a very crucial role. Uh, and then when we talk about multimodal imaging, yes, the convergence of these multiple images that these technologies take, they are helpful in functional and structural assessment of the patients, especially when we have patients with diabetic retinopathy. How much structure is damaged and how much visual function is damaged, we can actually correlate that. We can help the patient in the management, because the management will not just rely on providing retinal injections or lasers, right? So combining these modalities, the what they offer, that can help in detection, in managing these patients. When we talk about key areas of innovation, as I have told, artificial intelligence, advanced imaging, one of the most impactful developments, which is artificial intelligence, which can analyze, the large amount of clinical data at one go, AI. And everyone is talking about AI, but, using AI correctly is also one important factor. Because diagnostic accuracy and efficiency, if you're going to directly rely on AI, and it is not being tested prior, it becomes an alarm to all of us. We talk about advancing imaging. We talk about new imaging techniques that are provided that provide detailed insights into these eye conditions. We talk about smart contact lenses that present an exciting advancements, in wearable technology, allowing continuous monitoring of your ocular parameters. You can actually, track your diabetes with these contact lenses. Artificial intelligence refers to, definitely, I would like to explain on more into this, is that is going to refer to the computer systems that can perform these tasks, requiring human intelligence. But when we talk about in ophthalmology, AI systems are particularly effective because many can diagnose. Many of these diagnoses will depend on the visual analysis of the medical images. As we will have retinal images, we will have OCT scans together into that AI system. Machine learning algorithms can also be trained using large databases of images, allowing them, to recognize patterns and associated any other specific diseases if it is there. And when we talk about, significantly how this is potential, we have to work to enhance the accuracy, the diagnostic accuracy, the efficiency, and scalability also of the eye care services. It should be scalable. That is very, very important. Next, we have the AI enhancing when we talk in specifically in terms of diabetic retinopathy. Definitely, we know that AI is playing a crucial role over there. The most important benefits of AI is that its ability to enhance the diagnostic accuracy, right? So these systems are particularly valuable for large scale screening programs also. Like if you have patients with diabetes, and if you find out a village which is where people of diabetes are more, and there is no accessibility of the eye health care services, simple retinal photographs of those patients could be taken. They could be telemedicine services could be incorporated, or those images could be sent to an AI system, and those AI systems can actually analyze your retinal image and detect the abnormalities much faster than the traditional manual evaluation. These systems are particularly valuable in large scale screening programs where thousands of images need to be analyzed quickly. But Identifying suspicious cases early, AI can, allow clinicians to focus their attention to the patients and who requires an immediate treatment. That is where the clinician can only find out. You cannot solely wholly depend on the AI for detection of any particular diseases. Diabetic retinopathy, definitely leading cause of blindness among the working age adults nowadays. AI's algorithms can analyze these retinal photographs and identify the early signs of the disease, such as microaneurysms, we call hemorrhages, we call heart exudates, right? So these early detection is definitely critical because treatment at early stages can also prevent severe vision loss. AI powered screening programs are now being implemented in many countries to improve their early detection rates as well. Similarly, AI is very prominent and it's very effective in cases of glaucoma diagnosis as well. Glaucoma, wherein we talk about the increased intraocular pressure of the eye, which affects the optic nerve. This requires a very careful evaluation of the retinal nerve fiber layer as well as the optic nerve head. So these AI systems, when put together, they can analyze, the OCT scans, the glaucoma GOCT that I spoke about, and other imaging data, to detect the subtle structural changes that may indicate early glaucoma as well. And these systems can also monitor disease progression by comparing the sequential images over time. So today, an image taken 6 months later, an image taken a year after. So that sequential comparison, which is sometimes missed by the eye care practitioner, or the records are not maintained by the patient, or the patient switches between different hospitals for their treatments. So that common database will help the patient. This helps even the clinicians to make more informed treatment decisions for the patient. Advanced imaging technologies, the definitely, we have discussed already, modern imaging technologies have definitely transformed the way ophthalmologists, optometrists, they diagnose and monitor the eye diseases. But these diseases allow clinicians to visualize microscopic structures within the eye that were previously impossible to observe. And for example, the OCT, the adaptive optics imaging, the ultra wide retinal images, and these tools provide invaluable information about both structural, functional changes in the ocular tissues. The advanced contact lens, when we talk about smart contact lens, they are an exciting innovation in wearable medical technology. These lenses incorporate miniature sensors and electronic components that can monitor various physiological parameters in real time. For example, intraocular pressures or even the glucose levels, which is there in the tears. So it can help monitor that the glucose level in the tears and help the patients who are having diabetes. So glucose monitoring contact lenses have been, one of the most famous, I would say, innovations in recent times. And the uh, these lenses embedded with the biosensors, the miniature sensors, continuously measure the tear fluid glucose levels, offering diabetic patients a non-invasive blood sugar tracking. Like you don't have to prick your finger all the time to monitor the glucose levels. Drug delivery systems definitely incorporate, micro reserves that release medications directly to the eye at the controlled rates, and revolutionizing, this can also be helpful in patients with glaucoma and dry eye management as well. We definitely have advanced contact lenses like scleral lenses for treating the patients with dry eye. But when we talk about drug delivery, these lenses have been effective. So that real-time monitoring, provides continuous support to the ocular parameters that offers benefits to the disease management as well. And this could provide more accurate information than occasional measurements do in the clinical visits, because you might measure your glucose level in the morning, then after eating your food, or then in the evening probably. But this contact lens will help you to monitor your blood sugar levels throughout the day. And that provides a significant evidence to the clinicians for, a better treatment, the better management that could be provided to a patient who has fluctuating sugar levels. Next, we can talk about gene therapy. Gene therapy represents a revolutionary treatment approach for inherited retinal diseases, and this therapy works by delivering a functional copy of defective gene into the retinal cells. So that defective gene into the retinal cells allows them to produce the normal proteins. So that normal protein that is produced, now this technique has already been shown, promising in various conditions. One of the conditions I would like to name here is the Leber congenital amaurosis. That is one LCA, that is a low vision disease, common disease which causes low vision among patients. And so here that this innovative treatment is specifically for the inherited retinal diseases. So that you are going to deliver that corrected gene directly into the retinal cells, and that will enhance your vision restoration possibilities and helps the advancing of ophthalmology. Gene therapy, as I told, this represents a paradigm shift in treating the inherited retinal diseases. It is still at the clinical trial stage. Clinical trials have definitely shown better visual restoration, but if you say it is today available in today's market, today's eye care industry, easily available in our country, India, I would say it is a little limited one. Teleoptometry or teleophthalmology has expanded widely. The use of digital technology to provide eye care services remotely is one of the important and is, one of the need of the hour. Patients can undergo vision screening, imaging at a remote location as well, and the data can easily be analyzed by the specialist who is located elsewhere. So, a normal vision technician who does not know how to the correct diagnosis of the retinal, the retinal disease, those retinal images can be captured by the vision technician, by the optometrist, can be sent to the lab, can be sent remotely through those optometry telemedicine machines to the ophthalmologist, and they can analyze it. They can provide the treatment to the patient. And this approach definitely has improved the access to eye care, particularly in rural and the, I would say, that underserved areas. Teleophthalmology is revolutionary in today's practice. In India, if we say in South India, this practice is very commonly followed, and it is helpful for remote screening programs also, especially when it is about screening of glaucoma, screening of diabetic retinopathy. And various researchers are nowadays being published which talks about the teleophthalmology models, and this model has expanded the screening rates. I would like to highlight here rate over 200% in pilot programs. So this is a huge expansion in the eye care industry today. Next is the robotic surgery. Robotic surgical systems enable surgeons to perform extremely delicate procedures and definitely, with enhanced precision. These systems reduce hand tremors and allows, movements that are, more precise than what is possible manually. Robotic surgeries has the potential to even improve the outcomes in complex ophthalmic procedures when you say that. And this is also there. This surgical precision has redefined, and various instruments, robotic systems like platforms, they have enabled helpful. They have enabled various procedures like vitreoretinal surgeries, where it was previously impossible by the human hands alone, because with the any tremor, the filtration can happen, the fluid of the eye can move, can shift to the layers of the choroid, so that has reduced. Regenerative ophthalmology, as we told about the gene therapy, stem cell therapies with tissue engineering are revolutionizing the treatment for previously incurable conditions as well. I'm sorry. Limbal stem cell transplantation now restores vision in various diseases where the corneal surface disease like dry eyes, severe dry eyes. Stem cells. This is a very common practice which is done by the corneal surgeons for restoring the vision of the patients. Virtual reality is one of very increasingly used when we talk in terms of optometric management for vision therapy and rehabilitation in low vision patients. Virtual reality environments allow the patient, to perform the visual exercises in an interactive and an engaging manner, because virtual reality provides the patients with the real time scenario, right? And that can help the patient to perform and enhance their skills, so that will definitely engage the patient more. And this is one of the more innovative approaches, because it is not as that simple traditional method where the patient could be bored. These virtual reality therapies have various games, have various innovative skill based tasks that gives patient a trigger point. I have to achieve this point. There is an achieving goal in those therapies, in those tests that we do. And this approach is particularly very useful when we talk about conditions like amblyopia, or when we talk about binocular vision disorders. Amblyopia, where retina is fine, everything is fine, still the vision is less because a neural mechanism we need to treat for the patient. Future innovations and eye care will likely involve deeper integration of AI. I would say digital health technologies, telemedicine adoption, and personalized medicine as well. Advanced data analysts may allow clinicians, to develop individualized treatment plans based on the patient's specific age and everything. But yes, ethical considerations addressing the challenges that may involve, privacy, patient privacy, or the patient care, wherever a human touch is essential. Though you have a lot of innovation around, but a human touch plays a very crucial role. Uh, when you're talking about healthcare, when you're talking about eye care, because explaining the patient and giving them a counseling session about the disease, about the condition, about the management plan changes lives. That can actually change the perception of the patient also, because patients who have these diseases might feel depressed. They might have certain uh, you know uh, certain perceptions about what has happened to their eye, why they are not able to see. But a proper counseling, a proper explanation to the patient about the disease, how this could be corrected, how what are the available management options, can actually help in treating these patients in a better way, and giving them a consolidated I would say, like, what could be done, what is the future prognosis of that particular disease. That becomes very important, because it always say that you have to treat the brain, you have to treat the mind of the patient. It's the eye disease, but still treating the mind psychologically, making it psychologically treating the patient plays a very crucial role. Personalized medicine, as I told, is revolutionizing the eye care, and genetic profiling, tailored treatment plans, preventing eye care strategies. These all are becoming central to reduce the vision loss, the visual impairment which is there globally. Treatments, gene therapies definitely help in restoring those vision. The future of eye care holds an extraordinary promise, definitely. Like, we have nanotechnology now coming into picture. We have interfaces in virtual reality which can help in treating the patients who have suppression, amblyopia, various neurological problems. Even patients who are having stroke, or who have undergone any cerebrovascular accident, or even a traumatic brain injury, studies have shown that these patients also suffer from visual problems. These people also have issues in reading. Very simple task, reading. Right? We can read maybe 100 words per minute, but a patient who has a stroke or who has a traumatic brain injury, which is severe, can actually read even 30, can actually read 30 to 40 words per minute. So you see the speed with which that person is reading. whole life he has read 100 words per minute, and after this particular incident, if he is able to read only 40 words per minute, the patient's level of motivation about living, about having a healthy lifestyle, that all is demotivated, right? Because he feels that he can even not even read a newspaper. And imagine this happening with an old person, 60-year-old, 70-year-old person who is just, maybe probably at home and is just relying upon newspapers, books, and, that is the source of entertainment for him or her, right? So that is one constraint. So definitely we have treatment, we have availability of these new innovative technologies in for even treating these patients. These virtual reality programs are specifically designed for these neural problems as well. These therapies can actually treat patients who have visual neglect, or who have visual field defects as well, right? And to talk more on this, probably, if I would say that, as an optometrist, definitely awareness and learning of an optometrist of how they're treating their patients, the awareness of what all is available in the market becomes very, very crucial. Healthcare providers definitely must ensure that they are using these technologies and they're implementing these technologies very responsibly. Data privacy, algorithm, biasness, patient safety, all of this must be addressed very, very carefully. And with this, I would like to conclude the session. Technological innovations are definitely transforming the field of eye care and advancing, artificial intelligence, imaging technologies, gene therapies that we discussed, digital health, are all improving diagnosis, treatment, and accessibility of the eye care. These innovations offer definitely great potential to reduce the preventable blindness and improve the quality of life of millions of people worldwide. you know so with this line, I would like to close today's talk, and I am open to take suggestions. And I would also like to wish everyone a very happy World Optometry Day, which is coming this 23rd of March. Thank you. I'm happy to take questions, or you can also note down my contact details, email address, and also connect with me on LinkedIn. Thank
Thank you, Dr. Nayan Gupta, madam. It was a very studious speech and useful speech for all, because eye is the window of our body and how it should be cared from manually to robot, and after that virtual reality. So all the advanced technologies in taking care of the eye you have explained here. Thank you for your study speech. And I request all the participants they can unmute and discuss with our speaker on today's topic. Suresh sir.
Hello, good evening, ma'am.
Hello, good evening, sir.
Good evening, sir. Firstly, I very heartily congratulate to you that this is very knowledgeable session, and I think you have given a lot of information, the diagnosis about eye care. I'm very proud of you, ma'am. My question is, uh, what is the use of meditation and ancient therapy and nutrition? Please guide about this point.
Right. So, nutrition plays a very significant role when we talk about eye care, meditation as well. See, that I told you, sir, that any problem that has occurred to us, if we don't have a positive mindset as a patient, if the patient does not have a positive mindset towards that treatment, definitely the treatment is not going to succeed. That is what I believe. That is what my ideology about treating my patients. Nutrition like vitamin A is very essential. Vitamin D is very essential for eye problems. When we talk about condition like, as I discussed about myopia, which is increasing, right? Nowadays, even children, you see that all the school going students, if you see stand out in your balcony and you see school students going, you see that outside your society, half of the students, children that are going to school, they are wearing spectacles, and parents are worried about that, right? So their vitamin D, outdoor activity, distance task plays a very crucial role. And you asked about meditation. Definitely, mental practice, which helps the patient to focus, to maintain the attention, deep breathing, ucharan of the mantras, and reducing the stress and the anxiety have even shown significant research results in treating conditions like myopia. I would not say that it is way helpful in treating the structural changes of the eye that has happened, like this glaucoma condition. May there is a structural change that has happened, but conditions where like myopia and all these have it has been shown effective. If we treat the patient for stress or anxiety, definitely sleep quality also plays a very crucial role in treating these patients.
Thank you, Sam Suresh sir, by asking a basic question regarding our eye care. Now we request Dr. Sanand Shukla sir, please.
Hello. Good evening, Dr. BETKAR sir. Good evening, ma'am. Wonderful presentation you have made. And I think you have covered all the aspects, and especially you have more focused on the instrumentations and the technology which has been progressed nowadays. So definitely a very sophisticated operative procedures are taking place. And I think, you have discussed about diabetic, retinopathy and hypertensive retinopathy. That is also one of the major issue nowadays. We can find out people are carrying their diabetes, and along with the diabetes, if they are not taking care of, slowly it precipitates in a retinopathy, and loss of vision is very common. That is one thing. Now my question is, very important question is, people are taking steroids, or people are administered steroids, and steroidal cataracts are also common. So how we can prevent this steroidal cataract? That is my first question. And whether there is a recurrence of this steroidal cataract, that is another question. Because I had seen in one of my patients, he has removed the, means he has gone for the cataract operation, but still, he was going through the problems, and then again doctor has done some operative procedure. So that is one very important question. So iatrogenic disease, what we call it as. So that is the iatrogenic disease, because of the medication, the medicament has led to this kind of condition. Second, a very important question is, when we are talking about the refractive error and refraction, so they are nowadays so common, because as you have told that because of the television and the mobile, the screen times, all this plays a role. So when we are talking about this refractive error, many people doesn't realize only that they are suffering with the refractive error, because it is a progressive, slowly it is developing, and then one day maybe accidentally, or maybe they are finding very difficult, and then they are going, means the refractive error becomes very obvious, and then they are going. So I think if we can find out refractive error in a very early stage, we can halt the process. That is one thing. So is there any mobile apps are there to find out refractive error? Easy way, because every time we have to attend the ophthalmologist or optometry, and then standing in a queue, and then they are finding out your number, then they are going for this. Or maybe, you'll find the corporate world like, Lenskart and other people are coming, and they are earning like crores of rupees on this, just, checking the refractive error and giving the specs. So the corporate world is also there. So to minimize this expenses, can we have, simple mobile app that will track my refractive error? That's another very important question. And third thing is, when we are having refractive error, it always progresses. Why we cannot regress? Why there are no medications nowadays? Some LASIK operations and other things are there, but medications. Why we cannot reduce? That the problems. Right. Otherwise, you have discussed about glaucoma, and you have discussed about the nutritional. You'll find the blindness, xerophthalmia is also very common. So these are the points, very important points, and community-based points are there. So I was there connected with one of the Ankur project, which was sponsored by Winery Project, and in the village areas they were giving vitamin A prophylaxis doses and to prevent the vitamin A deficiency and leading to the xerophthalmia. So these are there. So these two questions are there, very important two questions, because we are working for the people, we are for the community, and how we can reduce their expenses. Otherwise in a private sector, ophthalmology is very highly expensive. I'd seen, and people are sitting like a shop, and they start talking about, you take this lens, you take this lens, you take this lens, this will cost this much, and the minimum is this. And naturally, the simple guy, he thinks about, I should go for the maximum because I'm going to place it in my eyes. So he selects
one. I should buy the one.
Yeah. So I think the ophthalmologist should suggest, what kind of, what is necessary for you. This is necessary for you. You go for this. So the people with the socioeconomic strata, the poor socioeconomic strata, they cannot afford. No doubt the trust nowadays, trust are there and the welfare trust are there. Their vehicles are moving in the villages and they collect the patients and all, but still, they have to pay something over there. So can we make it free for those patients? I've seen number of patients, geriatric patients with the blindness moving with their sticks in the villages. So can we do this for those people? Thank you very much. Otherwise, wonderful presentation you have made, ma'am. Thank you, really appreciable. Thank you, Dr. Principal, Dr. BETKAR, sir.
Thank you so much, sir. So, shall I? Yeah. So, sir, like you spoke about a very important topic, that is refractive error. As you told, can we diagnose refractive error sitting in a room with an application, maybe a phone application that we have? There are few applications which are available, and they are into the process of clinical trials. Go Check Kids is one application that I have personally even used for the screening purposes. But truly telling you, the accuracy and the efficacy of those machines or those applications is not that much reliable. As a researcher, I could find out various loopholes in that particular application. I would tell you the important thing here is why there are loopholes. See, sir, when you are getting an eye examination done, the eye is examined from the interior structure to the posterior to the retina, right? There is that axial length that you are measuring from your cornea to the retina is defining your refractive error. Now with a phone device, how do we measure that axial length? Because somebody might be having a camera which is 10 megapixels, somebody would have 20, and so on, and whatever varieties are there. So that accuracy lacks. It is available with Android also, it is available with iOS also, but the accuracy is not there. Second factor, the crystalline lens, जो हमारा सबका natural crystalline lens is there, that lens continuously accommodates. When we are looking at near, it is accommodating. When we are looking at distance, my lens in the eye is relaxed position. So analyzing that factors also plays a very important role when an ophthalmologist or an optometrist is prescribing glasses. Because you sitting at home checking your vision and saying that I can see, but when when you are into stressed conditions, when your eye is accommodating a lot, at that point in time there could be a chance that you are not able to see for distance, right? So I still don't have that answer, that which is the available and the best accurate machine which we have in today's practice. With a mobile device we can check refractive error, but yes, definitely this is a very good question and we should actually work towards it to find a cost effective application that can help in finding out. There are various applications which will tell you that yes, your vision is affected or you have a reduced visual acuity, but आपको कितना चश्मा का नंबर चाहिए? Is it -4? Is it -3? You go to one practitioner, they diagnose -3. You go to another one, after 10 days, they say it is -3.5. That reliability issues are definitely there in market, and that has to be controlled. I would say even if it is you're talking about kids, a cycloplegic, there is a drug called a cycloplegic treatment. You put that drug and then you take the accurate findings of refractive error in case of children, because बच्चों में हमें बहुत commonly दिखता है that the power is increasing day by day. myopia is increasing day by day. आज बच्चे का power -3 है, कल -3.5 हो गया है. So those cycloplegic refraction, which is done by authorized optometrist or ophthalmologist only. It will not be done on lens cart. It won't be done on with an optician or an ophthalmic store. So that can be refrained, as awareness can be created among people on that. And the other thing that you asked was about the screening programs that could be done about refractive error, the cost effective, which lens is better, whether should we go with anti-glare, whether we should go with blue cut lenses commonly, because the screen time is increasing. Sir, you take blue cut lenses. Truly telling you, researchers have shown that there is no significant impact with these blue cut lenses, which will help you to reduce vision, eye strain. So simple eye exercises, we call it 20-20-20 rule. So you focus at a distance of 20 feet, you blink 20 times, every after 20 minutes you do that exercise. That will help you to reduce eye strain. Okay, so there are certain small do's and don'ts that we all can do in our active lifestyle to avoid these eye strain and these activities. I hope I have answered your questions. And
Definitely. When I asked you about the iatrogenic, cataract development because of the medicament.
Yes. So, being an optometrist, definitely what information that I have is preventing that steroid-induced cataract. At one or the other point in time, you have to find out a steroids sparing alternatives, like some immune modulators, basically. Finding an alternative is very, very important, because if you keep the patient on that particular steroid, is going to hamper. It is going to cause other effects on the vision, and you can prefer topical or local steroids instead of systemic ones. Eating that Visolon every day, that could be avoided, rather than you can put a topical drop. That would be because the absorption rate is less. That could be given, and a regular eye checkup, because optic nerve head has to be examined in all these patients. Color vision is the one important test that has to be done for these patients who are on long-standing steroids. So, or NSAIDs can also be given in these patients.
Now, nowadays, I've seen that diabetic patients are having the ptosis problem is too much, ptosis. So I don't know whether it is related with the ophthalmology or it is something related with the facial muscles or maybe the ocular muscles. So that ptosis is very common nowadays, what I have observed in my practice. And definitely, you'll find the retinopathy, people are going for some injectables in the retina and other things to regenerate. So that is also nowadays big concern, because it consumes a lot of the finance of the patient. I think they are costing something like 25,000, 30,000 each injection, and they have to go for 5 injections or something like that. So I think the prevention is better better than cure. Because in a diabetes, I had not seen that there is again regress of the disease and coming back to the normal. It is very uncommon thing. So the very important message what I can feel, that people should pay attention to their eyes, especially they go for fundoscopy, retinal examinations, and they should know their status of eyes. So eyes are the windows to see the world. So with this word, I will conclude. Thank you very much. Really appreciable. It's a very extensive presentation you have made, Dr. Sir, Principal Sir. Thank you very much.
Thank you so much, sir, for your words of encouragement. And the one that you told about ptosis, that is commonly because diabetic, somewhere it is nerve damage as well, right? That if it is long term, if it is uncontrolled diabetes, so that neuropathy is somewhere related to the facial nerve as well, and causing ptosis in these patients. So controlling diabetes with the help of physician in touch, ophthalmologist, you definitely have to check about get your retina scanned at every 6 months, 4 to 6 months, because if you have a fluctuating sugar level, the nerves are going to, the blood vessels are going to burst. It is going to cause hemorrhage and microaneurysms, and definitely those changes are irreversible. Then definitely injections are helpful, or lasers are commonly given in these patients, and that damage that is happening to the retinal nerve layers is irreversible.
Thank you, Dr. Nayan Gupta, madam. We
Thank
discussed
you.
with our speaker, our Dr. Sanand Shukla sir. He is the single person who understood every medicinal terms, because he is a self-professor from the medical college and working in the tribal area. So always thinks about the minimum expenses for the people in this treatment or the diagnosis or every factors. He is the very best teacher working in the NSS field, also awarded teacher, and we are proud of him that he always discusses with the speakers, maybe topic from medical field, maybe topic from the education, law, technology, finance, everything. So he's the full of knowledge and discussing every day, and which concludes our webinar, and it gives rises to a standard that the participant, those who are here, they are also knowing, and they are also curious about the discussion, all these things. Thank you, Dr. Sir. Many resource persons have remarked about the Dr. Sanand Shukla's discussion, which gives a fruitful concluding to our webinar. I am also thankful to all the participants, those who are joining here daily from every day. And thank you, doctor, for your time, because I know that doctor is having more busy schedule. And in that busy schedule, also being a teacher, you have joined here, accepted our invitation, and explained about the advanced techniques in the eye care technique from evolution also. Thank you, ma'am. In future also, you will be here for new topic as per your convenience of time. I am thankful to Surya Vyas sir. Also, I am thankful to Priti Kumari. I am thankful to all participants, those who are joined here. Thank you, ma'am.
Thank you so much, sir. I appreciate your effort, and the effort that you're taking in organizing such events. And I am very much sure that this is a very beneficial, beneficial for each one of us as a practitioner. I wish you best of luck for your future webinars as well. Thank you, sir.
Thank you. Thank you. And we best wishes for day, which is ophthalmology day in future, to all opticians and all the teachers who are working there. Thank you. Thank you.